Ever wondered what makes anxiolytics so essential in the world of medicine? Well, let's unravel this mystery together. Anxiolytics, also known as anxiety drugs, are a type of medication that helps to alleviate symptoms of anxiety in individuals. They play a crucial role in the treatment of a variety of anxiety disorders, including generalized anxiety disorder, panic disorder, and social anxiety disorder, among others. Anxiety is not just about feeling stressed or worried, it's a serious condition that can interfere with one's daily activities, and that's where anxiolytics come into play. They work by altering the chemical balance in the brain to help reduce the physical and psychological symptoms of anxiety, but not all anxiolytics are created equal. Different types of these drugs work in unique ways, and each has its own characteristics. From Amitriptyline to Fluoxetine, we'll explore these different classes of anxiolytics in detail. So let's dive into the world of different anxiolytics and understand their unique characteristics. Starting with Amitriptyline, a classic example of tricyclic antidepressants. Now, tricyclic refers to the chemical structure of this drug, which includes 3 rings of atoms, but let's not get lost in the chemistry. What we need to focus on is how Amitriptyline works, what it's used for, and its side effects and contraindications. So, how does Amitriptyline work? It's pretty simple, really. Our brains are a constant hub of electrical activity. This activity is regulated by chemicals called neurotransmitters. Amitriptyline works by increasing the levels of certain neurotransmitters in the brain, specifically serotonin and noradrenaline. This in turn helps to elevate mood and relieve feelings of anxiety. But where is amitriptyline commonly used? Well, it's not just about depression. Amitriptyline has proven effective in treating nerve pain and certain types of chronic pain. It's also used to prevent migraines. In fact, it's like a Swiss Army knife in the world of antidepressants. Now, every medication has side effects, and amitriptyline is no exception. Some of the common side effects include dry mouth, constipation, blurred vision, and drowsiness. But remember, not everyone will have these side effects. It's also important to note that these side effects often improve over time as your body adjusts to the new medication. And finally, contraindications. Amitriptyline should not be used if you've recently had a heart attack or have a heart rhythm disorder. It's also not suitable for people with certain types of glaucoma. As always, your doctor will weigh the benefits and risks before prescribing amitriptyline. So there you have it. Amitriptyline, an old but gold standard in the management of certain types of anxiety disorders. It's not a new kid on the block, but it's still a key player. Its wide range of uses and proven effectiveness continue to make it a reliable choice in the world of mental health. Moving on to chlorpromazine, a phenothiazine that's more than just an antipsychotic. Chlorpromazine is a multifaceted medication that has been a cornerstone of psychiatric treatment since the mid-20th century. This versatile drug has an interesting mechanism of action. It binds to dopamine receptors in the brain, particularly D2 receptors, and inhibits the effect of dopamine, a neurotransmitter that plays a crucial role in our mood and perception of reality. By reducing the activity of dopamine, chlorpromazine can help manage symptoms of psychosis, such as hallucinations, delusions, and agitated behavior. But its benefits don't stop at treating psychosis. Chlorpromazine is also used in the management of manic phases of bipolar disorder, severe behavioral problems in children, and certain types of persistent hiccups. It can also be used as a preoperative sedative and to treat nausea and vomiting. However, like all medications, chlorpromazine can have side effects. Common ones include dry mouth, blurred vision, constipation, and drowsiness. More serious side effects, though rare, can include movement disorders, low blood pressure, and a condition known as neuroleptic malignant syndrome, which can cause fever and muscle stiffness. Chlorpromazine is generally well tolerated, but it's not for everyone. It's contraindicated in people with known hypersensitivity to the drug, those with blood disorders, liver or kidney disease, and certain heart conditions. It should also be used with caution in elderly patients, as they may be more susceptible to its side effects. In conclusion, chlorpromazine is a medication with a broad range of uses, from treating psychiatric disorders to managing persistent hiccups. Its mechanism of action, centered on reducing dopamine activity, offers a unique approach to managing these conditions. However, like all drugs, it must be used judiciously, keeping in mind its potential side effects and contraindications. Chlorpromazine, a versatile tool in the hands of a skilled psychiatrist. Next up is haloperidol, a high-potency antipsychotic from the Butyrophenone class. Let's delve into the mechanism of action of haloperidol. This potent drug works by blocking dopamine receptors, specifically D2 receptors in the brain. By doing so, it decreases the effect of dopamine, a chemical that is often found in excess in the brains of individuals with certain types of mental illnesses. This ultimately helps to balance the chemicals in the brain, reducing symptoms of psychosis and severe agitation. Now, you may be wondering, where is haloperidol commonly used? Well, it's primarily employed in the treatment of schizophrenia, a mental disorder characterized by distorted thinking, perceptions, emotions, language, sense of self, and behavior. Additionally, haloperidol is also used for treating acute psychosis, including manic episodes and drug-induced psychosis. Moving on to side effects, like every other medication, haloperidol has its share. These can range from mild to severe. Mild side effects may include dry mouth, blurred vision, constipation, and drowsiness. More serious side effects can include tardive dyskinesia, a condition involving involuntary movements, often of the lips, face, and tongue. It's important to remember that these side effects don't occur in everyone, and they often subside as the body adjusts to the medication. In terms of contraindications, haloperidol should not be used in patients with Parkinson's disease due to its dopamine blocking effect. It's also contraindicated in individuals with certain severe heart disorders, such as prolonged QT syndrome, due to the risk of causing serious heart rhythm problems. In conclusion, haloperidol is a powerful medication that can significantly improve the quality of life for individuals suffering from severe mental disorders. However, like all drugs, it should be used cautiously, taking into account its potential side effects and contraindications. Haloperidol, a powerful ally in the battle against severe anxiety and agitation. Last but not least, we have fluoxetine, a popular selective serotonin reuptake inhibitor. Fluoxetine, often recognized by the brand name Prozac, has made significant strides in the world of mental health management. This drug works on a neurotransmitter in our brain called serotonin, often referred to as the feel-good hormone. In a nutshell, fluoxetine slows down the reabsorption of serotonin into our brain cells, allowing more of this hormone to be available in the brain. This boost in serotonin levels helps to elevate mood and reduce feelings of anxiety and depression. Fluoxetine is primarily used for the treatment of major depressive disorder, obsessive-compulsive disorder, bulimia nervosa, panic disorder, and premenstrual dysphoric disorder. It has also found use in managing certain forms of bipolar disorder when used in combination with other medications. However, like all medications, fluoxetine does come with its own set of side effects. Common ones include nausea, upset stomach, dry mouth, trouble sleeping, drowsiness, sweating, or weight changes. More serious side effects, though rarer, can include unusual bleeding or bruising, unusually severe nausea or vomiting, or changes in sexual desire or ability. Fluoxetine also has some contraindications. It should not be taken in combination with monoamine oxidase inhibitors or within 2 weeks of stopping such treatment due to the risk of serious, possibly fatal interactions. It's also not typically recommended for those with a history of glaucoma or kidney disease without consulting a healthcare professional. It's essential to remember that while fluoxetine can be a game changer for many, it's not a one-size-fits-all solution. Each individual's response to the medication can vary, and it's crucial to have open conversations with healthcare providers when considering any new medication. Fluoxetine, a widely used option for the management of various anxiety disorders. It's a testament to how far we've come in understanding and treating mental health, but also a reminder of the journey still ahead of us. So you see, each of these anxiolytics has its own unique role and application. We've delved into the depths of Amitriptyline, a tricyclic antidepressant that's been a cornerstone in treating various forms of depression. We've explored chlorpromazine, a phenothiazine antipsychotic that has played a significant role in managing psychosis. We've looked at haloperidol, a butyrophenone antipsychotic that has been instrumental in treating severe and chronic psychosis. And lastly, we've examined fluoxetine, a selective serotonin reuptake inhibitor that has revolutionized the treatment of depression and other mood disorders. Each of these medications has its own unique story, its own specific use, and its own set of challenges. And each one plays a critical role in the broader world of anxiolytics and mental health treatment. This is just a glimpse into the fascinating world of medicine, a world full of discoveries, advancements, and life-changing treatments. Subscribe for more, because you won't find me later. Stay tuned for more in-depth knowledge about the fascinating world of medicine.